Okay. Hi everyone. I am joined here today with Spenser Andersen, who has been my Atlas Orthogonal chiropractor, helping me with my upper cervical instability, which is doing great, and I'll talk more about that. I've had so many of you reach out and ask, what are you doing to help stabilize your upper cervical spine? And so I want to share with you what I have been doing and the person I've been doing it with. He's got some great wisdom to share, and I also want to explain a little bit about, well, I want him to explain a little bit about what Atlas Orthogonal chiropractic is. I get lots of questions of what's Atlas Orthogonal, what's Blair, what's NUCA, what's normal chiropractic, and how they differ. So we're going to talk with somebody who can actually explain that better and share a little bit of his approach. I know a lot of people in my community are having this hypermobility syndrome thing happening, and upper cervical instability is such a key thing to investigate as to if that is actually playing a part into your chronic illness symptoms. I know for me, I was actually shocked when I was diagnosed with it just a few months ago. And we'll talk a bit about what the setup is for upper cervical instability, how it can affect your health and things like that. So thank you for joining me.
Absolutely.
Let's first of all talk about what is upper cervical instability and what are the things that you see lead to that, and then I'll share with you a couple of my own experiences of what I think has led to it.
Okay, so upper cervical instability primarily is where the ligaments that you have that stabilize your entire spine together all of a sudden no longer have the ability to do its job. And just kind of give you a little reference point, within your spine, every segment, every joint that you have has roughly 9 specialized ligaments that hold every joint together. And when we start breaking it down, we look at that the back of the spine, you have your spine that's in a column, you have the front of your spine, you have the back of the spine. The back of the spine actually has 8 specialized ligaments that stabilize your spine. And you only have 1 going backwards or on the front side. So what I mean by that is, like, if you were to tuck your chin down, you actually have 8 ligaments that are holding your entire spine together. And then when you go backwards, you only have the 1. And so to answer your question about what leads to the instability, most of the time it stems from some type of a trauma, whether it's a car crash, whether it's a fall, whether it is repetitive use. These are things that actually will cause the spine to deteriorate because the ligaments have some type of damage. And our body is an incredibly smart being, and we have 2 main supporting roles. We have the ligaments that actually stabilize the bone to bone, because the ligament is a bone to bone attachment. The muscle is a muscle to bone attachment, so they're different. You have a tendon that holds the muscle to the bone, and you have a ligament that holds the bone to the bone. So if the ligament doesn't have the ability to hold your spine together, your muscles have to work extra hard to stabilize it. And any type of emotion that you may have, turning your head, tucking it down, any type of a fall, having another crash, something that is more of a traumatic event for your spine, if the ligament already has some integrity issues, then your ligaments have a greater risk of becoming completely torn or a partial tear, and it becomes very unstable, which then puts you into this state of a lot of pain, a lot of inflammation. And if we don't correct that, then ultimately the spine is going to degenerate to the point that you develop arthritis. Again, the body is a very smart being, and if you have anything that says that there is an instability within a joint, the body is going to do everything it can to stabilize that. So it puts swelling, which then irritates the nerves, and the way that the body works, the nervous system communicates, is through actual electrolytes. And so if you've ever seen a stalactite or a stalagmite, basically it's a mineral that's within the water that just all of a sudden starts to slowly form this spike that's going down. And that's what happens within our body, because we use calcium as a communicative element within the nervous system. So ultimately you can develop a lot of arthritis. So that's probably a lot of way over the head Dr. Techno babble, but that's the gist of it.
So I also want to point out, with our population, sometimes they don't feel pain, they feel fatigue, they feel POTS, which is postural orthostatic tachycardia syndrome, they feel dizzy, they have vision changes. I did not have pain. I actually didn't believe I had upper cervical instability because I'm an expert and I would know if I had that. I was wrong. I was humbled. So
Right.
talk about that.
So the deal is that within our body, we have our nervous system, and our nervous system controls our entire functional being. 15% of your nerves are pain fibers. That's it. That means 85% of the nerves that you have within your body actually are controlling and running your body. And so, yeah, it's very likely that you can have instability and have absolutely no indication that there's a problem, because there's no nerve that says here is a problem, because it doesn't do that. It's not a pain fiber, it's a function fiber.
And I think it's important for anyone dealing with chronic fatigue syndrome, POTS, vision, a little dizziness, that they seek out an actual upper cervical specialist just to have that evaluation. I also want to say that a lot of people have kind of given me a little backlash, like, well, if you're the nervous system expert, why do you need something outside of you to help with your nervous system, to help with stabilizing C1? Can't you do that on your own? And I'm also a physical therapist, and I'm also trained in understanding the importance of structural alignment and integrity. Now, this has only been 3 months, and I feel pretty darn stable. And a lot of you have been dealing with this for months, if not years. So yes, I know some people who, do their posture, they change their nervous system, and somehow things kind of come together. But for me and what I know, why not actually have some help getting that C1 joint in alignment and helping to align the rest of my spine? Because frankly, chiropractic is nervous system regulation work. It's not separate, it's all together. And it's, I don't really like this, well, I'm just gonna calm myself way out of this issue. Yes, you can do that, but if there's something that can add to that can add to the ability to calm, and I'm telling you, when your C1 is off and you get that put back in place, the calm that you're capable of is so much easier than just trying to do it on your own. So speak to that.
So with that being said, we have to understand also that within your spine, you actually have a set of arteries that go up to the brain. These arteries are called the vertebral arteries, and they flow on the inside of the segments. So on a neurological standpoint, you may be able to calm the muscles to regulate the segment of your spine. But if there's rotation within that very top bone, especially when we come to the instability side of it, if that very top bone, the one that your skull literally sits right on top of, if that is off to any degree, then your head becomes out of balance. And if your head is out of balance, your eyes no longer pick up the horizon properly. So again, our body is amazing. So our body is going to put itself into whatever type of compensational pattern to bring your eyes back to level and to be able to keep the head over center. And if we start to deal with instability and your body goes in this change of position to bring your eyes back to level, all of a sudden the gravity of the skull, we have to remember that the head weighs about 10 pounds. Mm-hmm. That's not light. And the longer that you hold your head into an off position, the more these muscles are going to have to work harder. So if there's instability, again, the ligaments do not have the ability to hold the bone to bone, the head's going to start to slide. And if it starts to slide, it's going to impact the blood flow going up to the brain. And the vertebral arteries actually supply the back half of the brain. So if you can imagine, if your brain is segmented into two different parts, the front part that the carotid arteries supply, and the vertebral arteries supply the back portion, which causes issues within the vision and the balance and the hearing and the moods and aggression, the cognitive. These are all things that are affected on a vascular level. If you have a vascular or a blood flow issue going to the brain that's not able to supply enough oxygen to the brain, it doesn't matter what you do mentally, because on a physiological level, because everything is interactive, the mental and the physical, they have to interact together. But if the one can't do its job, the other one is not going to be successful to accomplish that. So the brain tends to receive less oxygen, and when it receives less oxygen, then it has a tendency to send weaker signals. And if it has weaker signals, then your body's not going to function properly. So with the instability, if the brain is not getting the oxygen and the body can't regulate it because the ligaments are not moving or stabilizing it, and the muscles don't get the signal from the brain to contract to stabilize that, then you're going to be at a deficit. There's no other way around that.
You know, I want to say that obviously you guys know my story where I was basically bedbound for over 10 years, diagnosed with chronic Lyme disease, mold toxicity, POTS, all sorts of things. I didn't know that I probably had upper cervical instability all
Right.
of that time. It just wasn't obvious, but I did have a lot of the neurological impingement signs, the fatigue, the POTS, the vision, etc. And I did, you know, I've taught lots of functional neurology exercises. I've taught self nervous system exercises, and I got to a certain functional level again without chiropractic. However, I am a physical therapist, so I was always doing different postural things. Now, a few years ago, I just want to explain my setup for why I think I finally went unstable. So I never really got my upper cervical dealt with, but I did work with posture for a long time. Then a few years ago, I start Primal Trust, and I'm at the computer 40, 60, 80 hours a week sometimes the last few years. I wasn't doing as much movement. I wasn't getting out and moving my body like I was before. And then this summer, I got a very severe infection in Central America. High fever, lots of inflammation over a few weeks. And that was the straw that broke the camel's back for me. I had a massive mast cell storm. Plus, I had been working in poor posture. And I think that the way my body had been compensating all those years of trying to hold C1 steady, it just couldn't anymore. And I just collapsed, and I started getting numbness in my hands and feet, started getting dizziness and vision changes again. I'm like, oh no, am I having Lyme stuff come back? Well, I got tested, negative for Lyme disease, negative for all these things. You know, that's great, but what the heck was going on? My doctor said, maybe you have upper cervical instability. And I'm like, no, I'm a PT. That can't be. I don't have pain. I just have all this other stuff. It reminds me of before. And sure enough, I went and got a DMX x-ray, which is a live action x-ray to look at how my joints move in real time. And we saw C1 basically slide right off C2, and the chiropractor diagnosed me with transverse ligament laxity, which is kind of a big deal because it's like hitting into your vertebral artery. So let's talk about what transverse ligament laxity, like that's a big deal.
That's a huge deal. You got to understand also, I mean, this is going to dig a little deep into the weeds, so I apologize for that. But when we start talking about the joints of every bone within your spine, the very top bone is basically something that just glides over the top. There are no bony locks that hold the spine together. It's once you get from C2 onto C3 is when we start getting into these bony locks. So C1, the Atlas bone, the upper cervical, is the most freely movable bone. The only thing that holds it in place are ligaments and muscles. There's nothing that prevents the bone from sliding one way or the other. So transverse ligament instability or laxity, that is a huge thing because that means that you have one less ligament that is actually stabilizing that upper bone. The other part that is probably the most critical to this whole entire thing, even more so than the blood flow going up, your spinal cord is at its largest diameter in the narrowest of canals. So if there's any excessive movement beyond what it is supposed to be doing, the only thing it can do is impact the spinal cord. And we have to remember also that the nerves that go from your brain to your toes still has to pass through that very top ring. And so it's a big deal because it affects everything. It's not just, well, this bone's nerve comes out and goes to your hand. It's the nerves that go to your hand have to pass through that first ring. And so if you have any type of a problem with that very top bone, it will affect everything. So transverse ligament laxity is enormous because of the impact that it has on the entire system.
And for a lot of people, it can just look like chronic illness.
Yeah.
And that is the big thing we're trying to point out here. So I just want to say that, yes, we do nervous system work in Primal Trust to consciously try to regulate our biology, but our biology also is also sending feedback up to the brain. And if our biology or our structure is off, it's often sending a signal back up to the brain of not okay, stress, sympathetic, unease. And yes, nervous system work can definitely regulate a lot of this, but adding the structural piece in, adding the somatic postural piece in, adding the alignment piece in could really be a win-win. And I think that's why I've had so much success in 3 months with a significant transverse ligament laxity by combining the skill set that Spenser has to the knowledge that I have, it was really a win-win, which is part of why we're making this video, because so many of you are suffering. All those years ago, I wonder how much my C1 was actually playing a part into my symptoms, where I thought, oh, it's just the mold, it's just the mast cell, it's just the Lyme, etc. Maybe there was some compromise in my brain to body communication simply from alignment. Maybe I did get a little better by doing my somatics and nervous system work at the time, but it wasn't fully corrected. It was just waiting for an insult, which happened.
The perfect storm.
The perfect storm, which happened. So what I see in my community for a setup for this, I see maybe some type of history of concussion or accident in the past. I had a couple concussions playing basketball in my early 20s and teens. Postural issues, weakness, getting deconditioned and laying in bed for a long time and really maybe messing up their posture. Having a mast cell storm with some type of infection, mold exposure. Even COVID is now kind of causing that sort of thing. Trauma, the way that trauma impacts us, where we kind of coil up somatically, that can over time be playing a part. Anything else I'm missing here?
Stress.
Oh, yeah.
Stress releases chemical release on pretty much every plane that's out there. And so if you are dealing with stress, then it is going to impact your body physiologically because of the chemical release that you have. That causes muscles to tighten up. And if you already have the instability of muscle that goes tight, the ligament isn't there to stabilize against that contraction of the muscle. So that's another problem as well. And one thing I also want to point out is that if you actually do have a ligament that is torn, whether it's a partial tear or a complete tear, that's a permanent injury. That never improves. So that's a lifelong thing that you need to be hyper vigilant about getting everything proper. Muscles, psychological, everything has to be done, and that's a lifelong thing.
And the cool thing is you can stabilize a joint with an injury. I mean, I was like, wow, this ligament is super loose. Can it stabilize? And he said, yeah, absolutely. We have so much other feedback there. And I mean, this might be a little woo-woo, but I also even feel energetically this alignment up and down our spine of our energy force is also a stabilizing factor. So we've got our posture, we've got our muscles, we've got our stress, our getting our inflammation down in our body, and even our energetic alignment that can stabilize the spine. So you are not a victim of a ligament injury. And I just want to say that you don't have to be a victim of it. There are so many things we can do, which is another reason why I'm making this video. I have a lot of people write in and say, well, I had this ligament injury and now I'm screwed and blah, blah. No, there's so much more. The body is brilliant. It has so many compensation techniques for that.
We tell our patients all the time that a permanent injury does not mean a permanent symptom. And so there is a way that you can stabilize it. And it does require effort. This isn't a passive game. You actually have to do the things that you need to do to create that stability for you. But it is completely possible. We've seen it hundreds of times over the last 22 years. People can stabilize an unstable ligament.
We're going to talk about Atlas Orthogonal. We're going to talk about your Posture Academy, which can help. We're going to talk about active versus passive mobilization to the spine to improve the curve. I also want to mention things I did, functional neurology exercises, strengthening, which strengthens the upper cervical, obviously vagus nerve exercises, nervous system work, energetic alignment work, grounding, all of these things, my posture, taking breaks at the computer. There are a lot of things that I did, and I really believe that getting my C1 positioned properly really set me up for success.
Yep.
And go ahead.
I was going to say that if you don't get the very top bone in place, it doesn't matter what you do for the rest of it. Going back to what I was saying just a little bit ago, that the way that the skull sits on top of that bone dictates and determines how the entire posture and your entire spine is going to function, because that you can correct any symptom. You can chase after any symptom down in your lower back, mid back, shoulder, doesn't matter. But if you never correct the reason behind why it was doing that in the first place, it will always come back. So you have to get this part taken care of first, and it has to be stable before anything else that we do within the spine is going to be effective.
And the good news is there are a lot of techniques that can help to correct that top bone, and there's a lot of chiropractic, craniosacral, other people that have these skill sets, myofascial release, that know how to correctly position, but it needs to be done by somebody who is trained in the upper cervical.
Correct.
I love the Atlas Orthogonal technique because in my research, when I decided to go with this particular technique, it was the most gentle that I could find and the most precise. I am somebody who's terrified of having my spine cracked and popped. I know some of you guys saw me with Dr. Bergman a few weeks ago on Instagram getting massive adjustments. It was experimental. It was it was amazing. He's an amazing doctor, but for me, I can't stand that feeling. It's kind of traumatic for me, so I needed a more gentle approach and something that was more in alignment with my philosophy on just my own somatic, my own ability for my body to find its home base through nervous system work, gentle postural exercises, and a very gentle upper cervical mobilization. I also want to say that in 3 months of working with Spenser, I've only had to have my C1 adjusted 3 times. It's not something we do all the time. And in fact, because he's also looking at the rest of the spine and getting at little bits of input to help take the pressure off from C1 holds. So it's not like you're needing to go into the chiropractor all the time. 3 times in 3 months did I have this adjusted. And really the first time was like the most major time where it was like, whoa. And then the next 2 were super, easy for me to integrate. So, that's also important. If somebody's having to adjust it over and over and over, you're missing something. You're missing something from the chain that's also driving C1 out from the bottom up.
Right. Now, but your case is very unique.
Okay.
So
as per usual.
But it's unique in not as good of a way.
Okay.
Most people that do not have ligament instability with the C1 bone, I've had, I don't even know the number of patients that I've adjusted over the last 2 decades where I've only needed to adjust their Atlas 2 or 3 times.
Wow. Over years.
Years.
Wow.
So once we get their Atlas to hold, if we do the rest of the stuff right and we take away the reason behind why on a structural level of why that very top bone is going out of place, then it tends to stay in place. Several of my patients, I'll adjust their Atlas and it'll hold for over a year, year and a half, 2 years, and unless something traumatic happens, it tends to stay there.
Yeah.
So it's literally the key foundation to your entire structure. If you don't have that right, nothing else is going to be right. But if you do it right, then it happens really quickly.
And I love that you have this whole body approach, which we'll talk about his Posture Academy, and that you're helping to keep things in alignment from the ground up to really give the support to that joint. And if that's done, that should hold.
Yep.
Yeah. So tell us about Atlas Orthogonal technique and what sets it apart from the others.
Okay, so chiropractic by the Greek or the Latin origin means to move by hand, right? So chiropractic is phenomenal, but Atlas Orthogonal chiropractic, we utilize an instrument. So we have this instrument that's right here, and it looks super scary. It's got this needle-looking thing, but it's not a needle. It's very rounded and smooth on the end. And all that is it's a stylus that actually helps to transmit the vibrational shockwave that happens on the inside. So inside this is a solenoid, and that solenoid comes down and strikes the top of the stylus and transmits that shockwave through this. And we can adjust it and we can move it to the degree that we need it to be. We can literally put it within a degree of what it is, and we get all that information from the x-rays. But this right here, the stylus, just rests right on the skin. It doesn't push in when you hit the button. It just sets there. And patients typically don't even feel the adjustment.
Yeah.
One of the most common reactions that they say after they get adjusted is, that was it? Like, yeah, that's it. You're not supposed to feel this adjustment. And what makes this so effective is the headpiece here. It's not comfortable. It's a hard rubber piece, but it opens up the joint between the skull, C1 and C2. And so literally C1 is just suspended there, held only by the ligaments and the muscles. And if it is off at a bad position, we set this instrument up based upon the mirror image of exactly the exact angle that it has gone, rotation-wise, pitch-wise, and shift-wise. So when we hit the button, it literally just drops right into the right spot. And it doesn't require the twist and the pop, the rack and crack, and that nobody likes. Well, some people like, but I don't like. And I'll be honest, I'll let you in on a little secret. For the chiropractor, it's fun. It's fun to do that, but it is not safe. It's not, well, I'm gonna catch some flack on that one. Yeah. It's not the best thing. How about that? Little backstory about mine. In chiropractic school, I would not let anybody touch my neck. They were not allowed to do any twisting or popping. It was only the Atlas Orthogonal. We call it AO for short, but only AO for my neck, and nobody else would I allow to touch that. Once I got out of practice, I actually merged my practice in with somebody else, and he did that twist and pop, and I needed to get adjusted. Prior to looking at the x-rays, I had a good curve in my neck. After those adjustments, after about 9 months of getting adjusted about every week, that curve was gone. And so we need to have that curve. So the Atlas Orthogonal is a vibrational shock wave that moves that top bone into the exact spot so the body can start the unwinding process up and down. And like what Kathleen was just saying, we use another instrument to facilitate the rest of the segments. We use an activator. It's a very light force also. It's 11 pounds. This is 6 pounds of vibrational shock wave, and the activator is 11 pounds. And we use it to find the individual bones to move it to exactly where it needs to go.
And I'll just say the way it feels, like it's just this little neat like thing, and it touches your skin, and it literally feels like it feels like a breath of air. It does not feel like even a pressure. It's so precise, and I was always like, really, that's it? But the first time I was adjusted, oh my gosh, my whole body had to find center. And so I want to say this too. My first adjustment, and he warned me, he said, it's going to be a little rocky because when you shift that bone, you have all of this feedback going into your brain that's different. And if you have a history of limbic system impairment, where your brain interprets everything that's different as threat, it can feel a little bit like this at first for somebody who has a heightened stress response. Like it was just like all this new feedback. And think about it, like if you were getting compromised feedback to your brain, and all of a sudden you're getting the floodgates open to feedback, that could be a little overwhelming. And I want to say that, and you handheld me through it. I was a little bit like, oh my gosh, just so much. And you were right. You said it's going to settle down, and it did. And it was a little bit like this for a few weeks. And then I remember walking and being like, oh my gosh, I'm feeling normal again. Yeah. And, so that first reset for somebody in our population can feel a little bit activating. Mm-hmm. It's just energetic communication coming online that's a little overwhelming. So you're going to need to do your nervous system work a little bit to integrate.
Yeah. It's one of those things that if the practitioner does not warn you that it could really throw you for a roller coaster, you may interpret it as this didn't work, or this made it worse, or what the heck just happened. I am never going to go back. Yeah. You've got to understand that when your body has been fighting for so long just to function, and all of a sudden you remove all of the obstacles that is keeping you from functioning at the optimal level, you're going to have an excited nervous system, and it is going to throw you for a roller coaster. So just be forewarned that when you get the A1 or the C1 bone put into the right spot, the right way, you may have a little bit of a setback in terms of the way you interpret it.
Yeah, it's more of a nervous system setback and like orientation at first, but it's, you get through it, do your nervous system work, so worth it. Here I am 3 months later with a significant transverse ligament laxity, doing great. Yep. Truly doing great. So I would love for you to speak about, what did I want to ask you about? Your postural academy. Mm-hmm. If Atlas Orthogonal, there's only 300 of you in the world. Roughly. If they cannot find an AO chiropractor, what's your next best suggestion?
Well, first off, it's you got to understand how to find an AO doc, and the way that you go, or to figure this out, is you go to a website called globalao.com. There's a spot where you can find AO doctors. I will warn you, just like what Kathleen said, there's 300 of us thereabouts, and it fluctuates as time goes on. There's not many of us within the world, and so finding somebody is going to be challenging. If you're fortunate to live in a town or close to a town that has one, then you're in great deal. Practice or a better setup. But if you can't find an AO doc, then my opinion is that the closest thing to AO would be NUCA. And NUCA is an upper cervical technique that takes the same films, analyzes it different. They use the hand to adjust it. There is the human variable. With the Atlas Orthogonal, it's a machine. There's no human variable outside of, can I set up the patient the same way? and it's really easy to set them up the proper way. But with any other adjustments, it is a hand adjustment. So the human variable is a part of this. So just NUCA is probably my closest recommendation to what I would say would be our closest ally to upper cervical and Atlas Orthogonal.
And then for people who maybe don't have access to this, what do you have to help people at home online to get them with at least getting that ground up alignment to help with upper cervical?
Yeah, absolutely. So kind of going back to the whole point why I became an upper cervical specialist, because the neck is literally the control center for the entire postural structure. And if you cannot get the Atlas put in the right way, then you have to figure out, well, how do you get the curve within your neck? There's a saying that where the head goes, the body follows. And so we have the tendency to have rounded shoulders. And what Kathleen was talking about was spending 6 to 8 hours on the computer. Well, that's a hands forward, hunched forward, and depending on what kind of computer you have, are you working on a desktop with a good ergonomic setup with the monitor in front of you? Or are you like most people where you have a laptop? And with the laptop, it's down low, you're looking down. And if it's a smaller laptop, then you tend to hunch in to be able to see the screen. So you create patterns. So if you don't have access to an upper cervical doc, but you are developing these upper cervical issues, then what I would recommend would be something very specific to what I have created called the Posture Academy. And the Posture Academy is an online fitness program. It's a medical fitness program that is very specialized in helping people to improve their posture through fitness. And these are very specific exercises, ones that I've created and also ones that I have gleaned and curated. But in terms of trying to improve your posture, your overall posture, and the nervous system, the limbic system, you have to be able to have good posture. And it's interesting that when we start talking about posture, there's really 3 components about good posture. You have the structural, that's what the chiropractic is for. That's what the physical therapy is for. It's to help the body on a structural side to be able to improve that. You have the mental, so what Kathleen is working with in terms of her program, it is to help the neurological side of controlling the posture. And the third thing, and this is where the Posture Academy comes in, is the physical. If you do the muscles, if you do not have the ability to strengthen the muscles in the appropriate way and do the things that Kathleen teaches within her program and do some type of an upper cervical approach to be able to improve the posture, your struggle with posture correction is actually going to be pretty high because you need all 3. We compare it to the 3-legged stool, and if you don't have those 3 legs, the stool will fall. And so I would say that the Posture Academy is really a program for people that don't have access to people like myself within the profession to be able to improve everything for them. And it's something that they can do at home. You don't have to be at a gym. You literally can do all these exercises in the comfort of your home at the timeline that you want it to do. So that's the purpose behind why I created the Posture Academy, because I have a lot of patients that travel from out of town. Again, there's only 300 of us, and so we have people that travel from all over. So I needed to give them something to be able to improve things. Now, does the Posture Academy remove the need for things like the chiropractic and the physical therapy and Kathleen's program? No, it doesn't, but it complements it. It is necessary for them to all be hand in hand.
I love that. And then the posture, how can they find you on Instagram or website or?
So my website is, this is really difficult, it's thepostureacademy.com. All you got to do is just go there, and right now we are actually offering a full free month of this program to test drive to see, is this something that will actually resonate with you? We start the program off with the cervical area because that is the paramount starting point. And so the first month is to get that curve going within the neck. After that first month, then it leads into what I call posture boot camp, and that is the actual fitness program. But yeah, it's a free month. Give it a test drive, and if you like it, don't cancel. If you don't like it, cancel, and it doesn't charge a card at all.
I've had a lot of you asking me for resources for the structural stability, and so this would be a great first one to start with. And then describe real quick the difference between passive versus active mobilization to get the neck curve back. The goal, getting the neck curve back, and yeah, talk about that.
So this is called a Dena roll, and not dinner, but a Dena roll. And this is something that you literally can only get through your physician. You cannot find this online. The developers of this have been incredibly stringent about this, And if I were to just hand these things out, he would actually stop selling them to me, which means I can't serve my patients better. But the dental roll is a passive means. So you literally just lie on this thing and it folds your neck over the top of this. This top ridge goes on the lowest aspect. So Kathleen, if you want to,
Yeah.
it goes down here, which means this flat portion of it goes below the shoulder blades. It's going to feel really low. But the reason behind why we don't just say go here is because maybe Kathleen has a really good curve here and a poor curve up here, which means it needs to go to the appropriate area. So this is why we take x-rays to be able to identify where things are. But not everybody gets this because, again, you have to be a patient of another chiropractor that sells these things. This, on the other hand, is called a posture band. It's what I call the posture band. It's very simple design. It's got handles that is on a bungee strap. This portion right here will actually go behind your neck. And in the process of doing the exercises within my program, we have a specific exercise with this. You put resistance against the band and then you move your head. And so this is an active means. This is you doing a physical effort to try to improve the curve within your neck. This is very passive. You literally just lay on it. It's very researched, but so is this. The exercises that go along with the posture band apply to the dental roll, but it's specifically designed for improving this with the posture band. So that's the difference between passive and active. They both work. Passive takes a little bit more time.
Mm-hmm.
Active, I like being hands-on. I like actually taking an active role within my own health, which is why we created this.
And I'll just say, like, for me early on, I couldn't even tolerate this at all. So there's also a graded progression for these things. Early on, I might have been able to do like a couple degrees of motion. So I'm sure in the academy, you kind of walk them through exercises to progress these things. Like, you don't just with upper cervical instability throw yourself over. I tried that. It didn't go well. It doesn't
work.
It doesn't.
Go ahead.
Oh, it just set me back. So
yeah.
But now I can lay over this for like 20 minutes without a problem.
Right.
3 months later.
3 months later. If you have severe instability within your neck, my program will work for you. And that is probably one of the biggest concerns that people have. The difference is that you have to be more gentle about it. You don't get to do it at the same level because you have the instability, but you can build up to it. So if you do decide to join my program and you have instability within your neck, please understand that it is progressional to get to the point where you can do it without injuring yourself. But really, you're just setting yourself back a little bit. But it is very doable and very easy to do.
Awesome. Well, I think that wraps up the questions I have for you. I think this is really, really informative. And just to give you guys hope, there are people that can help with this upper cervical issue, and there are programs to help you stabilize so that it can hold no matter what your history is, what your hypermobility is, and things like that. I see people, I wanted to say, like, since I've shared that I've had upper cervical instability, I've had numbers of people writing me that they have totally healed from this and totally stabilized. They've totally healed from their hypermobility syndrome as they switched off their stress response, calmed down mast cells, stabilized their structure. So there's so much hope here. None of these things are, final conditions that have to limit you. There are things that you can do about them.
Yeah, 2 things I want to say about that. One, there's no such thing as being too old. That's why they invented death. And so the second thing is that if you're still above ground, that means that things can improve. The other thing I want to say, though, is that if you guys actually have any questions that Kathleen may not know the answer, I would love to answer any of those questions. So just tag me in whatever post you have specific to that, and I will answer any questions that you guys have. I feel like if I can help you to gain a little bit more knowledge, it just helps set you up on a better path for your future.
Awesome. I'll be posting this on YouTube so you can answer questions in the comments on YouTube, and I'll have some like shorter posts on Instagram that you can answer. So thank you guys. Thank you so much for explaining this, and thank you for helping me with my healing process.